Welcome back to the Dental Docman. If you've ever wondered what happens during a tooth extraction, this video is for you. Today, I'll walk you through the entire process step by step from preparation to post-care. Let's dive in. Before any tooth is removed, the dentist starts with a detailed assessment. This includes a clinical exam and an X-ray. Why? To understand the tooth's position, the roots, and any potential challenges, like impacted teeth or nearby nerves. We'll also ask about your medical history. Conditions like diabetes, heart issues, or blood thinners can affect the procedure. Our goal is to ensure your safety at every step. Once everything is clear, we prepare for the procedure. The tools are sterilized to prevent infection, and we'll explain every step to make you feel comfortable. Now let's talk about one of the most important parts: anesthesia. We use local anesthesia to numb the area around the tooth so you won't feel pain. The type of anesthesia and injection site depends on which tooth we're extracting. For upper teeth, we use infiltration anesthesia, injecting near the tooth's root to block the nerves. For lower teeth, especially molars, we use a mandibular nerve block. This numbs not just the tooth but the entire side of your jaw. For added comfort, we sometimes use palatal or supplementary injections for deeper numbing. Don't worry, it sounds scarier than it feels. Once you're fully numb, the extraction begins. For a simple extraction, we use an elevator to loosen the tooth, followed by forceps to remove it. It's quick and painless. But if the tooth is impacted or broken, we'll need a surgical extraction. This involves making a small incision in the gum, possibly removing a bit of bone, and dividing the tooth into smaller pieces. This ensures a smooth removal. After the tooth is out, we place gauze to control bleeding. It's important to bite down firmly for 30 to 45 minutes to help form a clot. To manage pain, over-the-counter medications like ibuprofen work well. If needed, we'll prescribe stronger painkillers. And for swelling, a cold compress is your best friend. 15 minutes on, 15 minutes off. One thing we really want to avoid is dry socket. This happens when the blood clot is dislodged, exposing the bone and causing pain. To prevent this, avoid smoking, using straws, or spitting for at least 24 hours. Healing happens in stages. Within 24 hours, a clot forms. By the end of the first week, the gum starts closing up. Full healing of the bone and tissue takes about 4 to 6 weeks. Stick to a soft diet for the first few days, and rinse with salt water after 24 hours to keep the area clean. And there you have it, the complete guide to tooth extraction. Remember, extractions are a safe and routine procedure, but preparation and aftercare are key. If you found this video helpful, don't forget to hit that like button and subscribe to the Dental Docman for more dental tips and advice. Have questions? Drop them in the comments below, and I'll see you in the next video.